Hi everybody, welcome to today's YouTube video. For those of you that know me, I'm so happy that you're back consuming some new content, continuing your journey of health and wellness. For those that are new, my name is Dr. Elise Tercy and I'm a holistic doctor here in New York. And today I want to share with you a topic that is unfortunately very difficult to deal with. And a lot of my women that are watching this can definitely attest to this. And we're talking all about a rash, a relentless rash called perioral dermatitis that just doesn't seem to want to go away. I do want to share some things that have worked, some things that haven't worked, some things that I've seen that are supporting the rash, and we'll talk about some next steps as well if you're dealing with this. So stay tuned. What is perioral dermatitis? Perioral dermatitis or periorbital dermatitis, it's a rash that usually develops around the mouth within the nasolabial folds, and it does not typically encroach on the vermilion border of the mouth, so it spares the margins of the mouth. Sometimes it can actually develop periorbital as well, which just means around the eyes. And the rash usually happens in women that are in their childbearing years, typically age 25 to about 37 is the kind of classic presentation age-wise of the rash. Now, the reason I'm sharing this with you guys is because I personally have dealt with this rash. I've undergone treatment for this conventionally and holistic, and I do want to share with you what's worked, what I've seen that has worked, because unfortunately, there is not a lot of options. There are not a lot of options out there for this type of rash, and it's unfortunate that so many people are struggling and they don't really know where to go with this. So I do want to share with you guys some things that have worked. But before we do that, I also want to talk a little bit more about the presentation. So it does typically happen around the mouth, around the eyes, and it starts off as little small red pimples. They look like pimples. Often they don't erupt if you go to pick at them, which obviously you shouldn't do, but if you did, you'd probably say nothing is coming out of this pimple. Like, I don't understand it. It's usually little clusters of pimples that get very itchy. They're very itchy, and sometimes before the actual rash develops, we might just feel itching. So we might just be like, why am I itching like this a lot? A lot of times two hands are involved. People are like, I'm itching the sides of my mouth and also my eyes, and it's because the rash is causing some irritation. And then what typically happens when it does present is you've got these eruptions that look almost like clusters of pimples, and they don't seem to go away. Now, usually what they say is that sometimes the reason the rash develops is steroids, long-term use of steroids, topical steroids, certain cosmetics and makeup compounds, and also fluoride in toothpaste. Those are the more notable things that do sometimes cause the rash. Sometimes when we come off of steroid creams or steroids, we get the rash. There is also a known component to hormone balance that directly is affecting the presentation of this rash. So we want to look at kind of all of those factors. Now, unfortunately for, I would say 90% of patients, they don't fall into the classic category of, yes, I did use medication, or yes, I do use fluoride toothpaste. They're kind of wondering, I don't get it. I don't really fit the picture of what causes this, but yet I have the rash. I had this as well. I dealt with perioral dermatitis for about 2 years before I really knew a lot about the conventional or about the holistic remedies, and it was relentless. And my journey was that I went to a dermatologist. I had exactly what I described to you, a little bit of itching, a lot of redness going on. I wasn't really sure what it was. And conventionally, they had recommended a couple things. I tried a couple things, and by a couple I mean lots of things. I did do metronidazole cream, I did Elidel, I did tacrolimus cream on my face, topicals, I did sulfur washes, Oracea, I even used doxycycline, three rounds of doxycycline. Did 50 milligrams, I believe, in the beginning, and then 100 milligrams twice a day. Nothing worked. I was literally at multiple dermatologists trying to get a second opinion, a third opinion. After 3 opinions, I said, forget this. I need to take matters into my own hands. So I did just that. I actually put myself on a viral protocol. I did a couple things enzyme-wise to support me, balanced out some of my hormones, and the rash disappeared. Thank goodness. The unfortunate thing is that people can spend so much time trying to really find out where this is coming from. And the only real options in conventional medicine is topical creams or antibacterials, antibiotics, and unfortunately, they don't always work. And if they do work, when you come off of the medication, it typically comes back. That was my experience, where it would work, the rash would be gone when I was on medication, and as soon as the medication was gone, the rash came back. That's exactly the concept of root cause medicine, where we really want to get down to the why of the condition, not just throw something at it that might not work. I'm not knocking the conventional realm. I think that if that's worked for you, I'm so happy that you've had success. It's up to you how you choose to treat your body in terms of healing. I did opt that route. Like I said, this was before I knew any of this stuff. I dealt with this for years. So I kind of was in the frame of conventional, not really knowing exactly what this was. And then I transitioned into like the holistic realm. And that's really where I got some more long-term sustainable results for the rash. Now, the interesting thing about this is that the rash does have things that are inside the cells. When they've done tissue biopsies, there's an immune component to the rash. There is lymphocytic infiltration, meaning there are cells of your immune system that are actually in the tissue. And so a lot of what we're finding is that there is an autoimmune component to this, or an immune system activation piece to this. So that's part of healing, and part of supporting this is that you'd want to look at the immune system and see if there's anything causing flags for your immune system to be on. Now, I underwent a lot of comprehensive blood work, full vitamin profiles, full mineral profiles, a full hormone panel looking at all three versions of estrogen, testosterone, cortisol, pregnenolone, progesterone, like the full gamut, full vitamin workup, vitamin B1, B2, B6, B12, all the stuff, glutathione, vitamin C. Luckily, I was fortunate enough to be able to do that in the holistic space. I'm able to connect with people that can order that stuff for me. But that's what I did. I also did a high dose, mega dose viral protocol, because there is a lot of research that shows viruses can activate the rash and cause dysfunction. So if you're watching this thinking, I don't know where else to go, I don't know what else to do, my best recommendation is to work with a functional medicine provider in your area, or even remotely, however you can connect with the right person, and undergo some hormonal support and a viral protocol, because that's going to be the most important thing that's going to drive your success long term. And like I said, this rash is relentless. It's relentless. And I am in a lot of groups that we talk about these different types of things. And unfortunately, all I see is the conventional medications not working. And it's so sad when people post the pictures of how flared up they are. And because it's on your face, in the middle of your face, it's so discouraging. You feel like, what am I going to wake up to? At least that was my experience. I would wake up thinking, what am I going to wake up to today on my face? Is it going to be worse? Is there going to be flare-ups? And the cyclical nature of this rash is there are flare-ups. We go into flare-ups. And the flare-ups can happen sometimes more in the summer months. I know women that have done zero therapy. They've done tons of topical creams. They've done systemic antibiotics for a year. Here comes the entire gut issues that arise with that. Now they've wiped out their entire microflora, their entire microbiota. They're getting frequent yeast infections. Their stomach is so bloated. It's just not the best option, and it doesn't yield the best clinical results. I would also encourage being gluten-free. Now, I did speak with my dermatologist about this, and she did say that there is a large body of literature, and she's seen clinically that gluten-free diets do support this. Removing eggs can also support this, because if there is a viral component, eggs do feed viruses. So that would be something to consider as well. Really looking at the whole picture. Start with a functional medicine doctor. Do a full comprehensive functional medicine blood work panel. Make sure that you have a nice gut health going on, nice microbiota, that there's nothing underlying. There might be some dietary modifications that you might have to do to help support the rash, but there are so many ways to support this long term. You might have to undergo a liver detox, a liver cleanse, some hormonal therapies, moxibustion, but it's all worth it, because at the end of the day, we have to keep trying. We have to keep being proactive and prioritizing our health, and we can't just give up and say, I don't know what to do. I know it feels that way. It's discouraging, it's disheartening, but I'm here to tell you that I got rid of it. I've helped women get rid of it. You can get rid of it. It's doable, okay? So I just wanted to let you guys know. I know this is a very short video. Typically, they're a little bit longer, but I did want to put out some content for you guys. That way you can learn a little bit about it and understand there are next steps regarding this rash. So thanks for tuning in, and I'll see you either in the comments or the next video. Follow me on Instagram, Dr. Elise Tercy. I'm on Facebook, Dr. Elise Tercy. Website, Dr. Elise Tercy. I'm Dr. Elise Tercy on all platforms in case you want more information, or if you want me to help you connect with the right person or even connect with me, be happy to do so. Thanks for watching, guys. See you next time.